Hello there, and welcome to a short recording here as we get towards the end of the semester in Intro to Veterinary Science. This is Unit 14, where we're going to quickly discuss common diseases of companion animals. So let's get to our content here real quickly. First one that we'll chat very briefly about here is parasites, and there's a number of them that we have to be concerned with when we talk about companion animals, and I've listed a number of them on the left here. Simple identification is through visual observation of the animal themselves and a little bit of testing. We're going to do a quick unit on parasitology to wrap up this semester, so we won't go into a great amount of detail specific to companion animals here, but basic prevention would include some visual inspection on occasion and regular deworming treatment. That will help, of course. There are many dewormer-type pills, heartworm medications, and things of that nature that you can give regularly to companion animals in order to keep them safe from these particular parasites here. And then, of course, if needed, in terms of control of an already infested problem, is some anthelmintic and supportive therapy treatment. Also, really quickly, we'll talk just briefly about ringworm. Not a common type problem with companion animals, but certainly could be problematic. And again, don't forget that it is a zoonotic disease, so as you would happen to have an infected dog or cat with ringworm, you could also contract it pretty easy. And of course, it is signified by bare, kind of grayish circles of very itchy or dry, scaly skin. And the way to treat it is simple iodine baths. So there's a variety of different treatment shampoos, and then keep the animal, keep those patches dry, get it in the sun as much as you can in order to help combat this particular problem. Of course, pet allergies are a significant problem when we talk about companion animals, and most of them signified by itching or inflammation, occasionally stomach upsets or things of that nature. And the three top causes of typical companion animal allergies are the type of food that they're consuming. There may be a blend or something in that food that they just simply cannot handle. Environment can on occasion cause it, and fleas, of course, can cause allergic reactions. Of course, there are endocrine diseases that we have to worry about. Diabetes is actually quite common in dogs and cats, and so there are occasions where you would have to check glucose levels in dogs and cats, just like humans have to do. Also, of course, we deal with weight control problems in both dog and cats, and it's either caused by hypothyroidism or hyperthyroidism, so either underactivity or overactivity of the thyroid, because both of them affect the metabolic rate and could lead to different weight control type problems. Next is, of course, cancer, and very similar type nature of the disease when we talk about cancer in companion animals that we would happen to have in humans. The tumors can be both benign or malignant, can affect the animal in just about any bodily system, unfortunately. And of course, very limited in terms of treatment options, either pretty aggressive chemotherapy type options for treatment or surgery or both. But unfortunately, something that we have to think about with regard to companion animals. Next, then, is, of course, hip dysplasia, much more common in dogs than cats, but a number of different causes here. Of course, it can be genetic, and we know that it runs in different breed lines, especially larger breed dogs. Poor nutrition can also cause it, because we get maybe mismatched growth of the hip in the socket, and so therefore that could be genetic. It could be poor nutrition. It could be a combination of both. It could be other causes, an injury or something of that nature. But basically, you don't have a correct fit of the ball in the hip joint, in the socket of the hip joint, as that animal develops. And so, of course, then as that socket relationship does not match appropriately, it deteriorates over time because it's not functioning. And so eventually you'll see observe stiff and painful movement, typically decreased activity because they cannot move appropriately. They may not sit down like a dog is known to sit, with their body basically centered between the back legs. They'll sit on one side or the other. Their movement may be affected. They may kind of hop along, trying basically favoring one side over the other. So there's a number of different things. They may rise really in an awkward fashion. Instead of rising straight up, they may rise on one side or the other, or have to shift to one side to rise. So hip dysplasia, very problematic in certain breeds and certain dogs. Treatments, a balanced diet really helps keeping an animal in appropriate body condition. And then, of course, supplemental glucosamine and chondroitin is known to be helpful with these kind of things. There's a number of other different treatments as well, but weight control, carefully controlled exercise, and dietary restrictions as needed hopefully will help you with hip dysplasia. Of course, a few respiratory diseases to list here. Kennel cough, when we talk about dogs, that would be fairly common. Pneumonia in dogs and cats all the time is something, especially when they're young. And of course, relative to dogs and cats, is a problem with distemper, where you would have some pus or goopiness in the eyes and nasal cavity that you can vaccinate for. Digestive disorders, of course, also quite common when we talk about companion animals, and some of those, again, back related to food allergies. You can, of course, have episodes of diarrhea whenever, you can have simple upset stomach time periods, maybe a small little viral or bacterial problem that's in their stomach that runs its course for a quick little spell. And then, of course, there's a version of coronavirus that is inherent to companion animals, and parvovirus, which certainly affects young puppies as they're growing and developing, and oftentimes even before they are weaned, and can be absolutely fatal to young pups. So you want to be aware of that potential risk and vaccinate for that parvovirus early on. Help keep those puppies safe and healthy. So we'll wrap this up here. Again, I mentioned it would be a rather short segment. There's a few questions of quiz for you to complete in this section, and thank you for tuning in to this section.